In Nigeria, elders hold a revered place. Their wisdom guides us, their stories enrich us. But what happens when the mind, once a beacon of knowledge, begins to flicker and fade? Dementia, a cruel thief, steals not just memories, but also dignity and respect. The changes in behavior, often misunderstood, can evoke fear and suspicion. Traditional beliefs sometimes offer explanations that are far from the truth. This intersection of cultural beliefs and a lack of awareness about dementia creates a fertile ground for stigma to thrive. The whispers start, the rumors spread, and soon, the elderly are ostracized, labeled as burdens, or worse, accused of witchcraft. This essay delves into the heart of this often hidden crisis, exploring the impact of dementia in Nigeria. But beyond exposing the darkness, it seeks to ignite a spark of hope, suggesting ways to foster understanding, compassion, and support for those living with dementia and their caregivers. Dementia manifests in different ways: forgetfulness, confusion, changes in personality. In Nigeria, these symptoms are often misconstrued, attributed to spiritual attacks or witchcraft. Imagine a grandmother who forgets her granddaughter's name, or a grandfather who wanders off, disoriented and lost. In a community where traditional beliefs hold sway, these behaviors are often interpreted through a lens of superstition. The whispers begin, casting a shadow of doubt and fear. The accusations of witchcraft are particularly damaging, stemming from a deep-seated belief in supernatural forces. In the absence of knowledge about dementia, these accusations provide a convenient explanation, albeit a harmful and inaccurate one. The stigma attached to dementia becomes a heavy burden, not just for the individuals living with the disease, but also for their families. The impact of dementia extends far beyond the individual. Families, often ill-equipped to deal with the emotional, physical, and financial demands of caring for a loved one with dementia, bear the brunt of the stigma and misunderstanding. The responsibility of caregiving often falls on the shoulders of women, who juggle their roles as mothers, wives, and daughters with the added burden of caring for an aging parent. The lack of support systems and access to affordable healthcare exacerbates their plight. They are left grappling with feelings of guilt, helplessness, and exhaustion. The fear of stigma prevents many families from seeking medical help. They suffer in silence, ashamed to share their struggles. This silence only perpetuates the cycle of misinformation and fear. Witnessing a loved one succumb to dementia is heartbreaking, but to see them ostracized, accused, and mistreated adds another layer of pain. Section 4. Challenging beliefs, embracing understanding, the role of education. Breaking down the stigma surrounding dementia in Nigeria requires a multi-pronged approach. Education is paramount. Public awareness campaigns can play a crucial role in educating people about the disease, its symptoms, and its causes. It is important to dispel the myths and misconceptions surrounding dementia. We need to challenge the belief that it is a curse or a punishment. We need to emphasize that it is a medical condition, not a spiritual affliction. Healthcare professionals also have a crucial role to play. Training programs should be implemented to enhance their understanding of the disease and its cultural implications. Furthermore, it is essential to incorporate dementia education into the curriculum of medical schools, nursing schools, and other healthcare training institutions. Section 5. Community care, a tapestry of support. Beyond education, we need to build a strong network of support for individuals living with dementia and their caregivers. This includes establishing community-based support groups where caregivers can connect, share their experiences, and access information and resources. Respite care services are also crucial. These services provide temporary relief for caregivers, allowing them to take a break from the demands of caregiving and attend to their own needs. Government intervention is also needed. Policies that address the specific needs of people living with dementia and their families should be implemented. Creating a dementia-friendly society requires a collective effort, empathy, understanding, and a willingness to challenge long-held beliefs. Section 6. Conclusion. Towards a future of dignity and respect. Dementia is a global challenge, but its impact is felt acutely in societies where stigma and misinformation prevail. In Nigeria, we have a long way to go in our fight against dementia stigma. By embracing education, fostering community support, and advocating for policy changes, we can create a more compassionate and inclusive society for those living with dementia. It is time to shift the narrative, to move from fear and judgment to understanding and empathy. Let us remember that those living with dementia are our elders, the keepers of our stories, the roots of our families. They deserve to live their remaining years with dignity, respect, and love. Let us create a Nigeria where the sunset years are met not with whispers and accusations, but with the warmth of understanding and the embrace of community.